We're about 6 weeks into our coronavirus lockdown and starting to see a lot of people coming in to Podium Physio with elbow pain, presenting with tennis elbow. And the reason for that is getting involved in a lot more do-it-yourself jobs around the home maintenance, home repairs, and that puts a lot of strain and stress, or can put a lot of strain and stress on the elbow region. Tennis elbow is most commonly seen in men, and the peak incidence seems to be in that early 40s age group, with 42 being the most common age that we see the problem start. What is it? In younger people, and when it first presents, we know that it's an inflammatory condition that affects the tendon at the origin just here above the elbow. And in older people, so beyond their 20s, particularly if the condition's been around for a while, then it is actually no longer regarded as an inflammatory problem, but we know that it becomes then a degenerative condition. And the reason that the pain crops up is there's a discrepancy between the capacity of the soft tissues to do the work that's being asked of them, and the demand that's being placed on them at any one time. So one of the most common scenarios that I've seen over the years, and even more prevalent now, is paving. So the stress on the elbow is very, very strong when you are doing lots of grasping, lifting, and particularly with the hand pointed down. That particularly stresses the lateral elbow tendons and muscles. Treatments that we commonly use for tennis elbow include things like dry needling, Western acupuncture is another name for it. We insert the needles into the tendon where they arise from the bone just above the elbow. We can also use it in the muscles a little bit lower down. Strapping tape and bracing to support the muscle to reduce the stress on the bone where the tendons arise from. That gives people quite frequently a lot of relief when they are using the hand and arm for manual activities. Massage, frictions to this area, joint mobilisation to the where the radius, which is one of the forearm bones, where that joins to the humerus, the upper arm bone. Joint mobilisations there can be quite pain relieving. Most important in the long term for the treatment and maintenance of tennis elbow condition is strength exercise to improve the conditioning of the muscle and tendons in that region. Essentially, we've got to get the structure stronger, and one of the best ways we can do that is with a rubber batten. These go by a variety of different names, commonly called a Flexbar. And with this tool, you can do a couple of exercises in particular that are really, really useful for strengthening the muscle and tendon that cause tennis elbow, and to make sure that it's less likely to come back in the future. So the two main exercises we do with the Flexbar are the twists, and you might be able to see my elbow there if I can get rid of the flare. As I grip and rotate, the muscles just around here are very, very active. They are working. So that exercise is one of the main ones that we do. And then rotation. So this is an exercise or a movement called supination. If you're struggling with tennis elbow condition, pain on the outside of the elbow with manual activity, please feel free to get in touch with us here at Podium Physio, and we can help set you up with both some treatment and a longer term exercise rehabilitation program. The condition does require long-term maintenance.